Essentially, we put in a robot inside you, connected to a cable, connected to my console. It's just like playing a video game. My name is Dr. Abd Aziz Yahya. I'm a consultant Gynaecological Oncologist and a certified robotic surgeon at the Gleneagles Hospital Kuala Lumpur. This surgery is not done by the robots. The robotic component of the system is an application, but the surgeon is still the human guy. Essentially, we put in a robot inside you, connected to a cable, connected to my console. It's just like playing a video game. Whenever I ask my patient, they want to know a little bit more about robotic surgery, I say, "Do you see the movie Avatar?" Right? When the guy, all the bad chaps who are behind this monster machine, they're just a small human being in a humongous structure of robots, yeah? Shooting people, shooting trees, So I'm the shooter. That machine was just a carrier that carried me to protect me from. When you have a gynae problem, you have a mass from your uterus that you want it removed, right? Conventionally, we just cut you open under general anesthesia. You get your centimeter with a big scar. We remove your mass, stitch you back, right? Because the scar is big, you're going to be in pain for quite a bit. You're going to take time off from work. You can't function and be productive. The key point in medicine is we always talk about returning to being productive. When I say my surgery is successful and it was very helpful to you, what I meant to say is that today I operated on you, in 1 week you can go back and do your regular job. If you're a mother, you can go back and being a mother. If you're a professional, you can go back being a professional. And do what you need to do, go do your grocery, drive your car, that kind of thing, despite removing a huge mass from your body. Now in medicine that's good, because we don't lose, economically we lose nothing. The patient can go back and be productive. Why? Because robotic surgery involves small scars, very tiny scar, about 1 centimeter. Very little blood loss during the surgery, a very limited number of complications. In surgery, there will always be complications, whether it's major or minor, there will be some complications. But for robotic surgery, because the precision involved in the platform of the Da Vinci system, the complication rate is rather small. But once you do a robotic surgery on the patient, you can see the smile the next day. I think that's the beauty about doing this keyhole robotic surgery. The recovery is very, very, what shall I say, appreciated by the patients and the family. Sometimes you see patients go back home to their car on a wheelchair. None of our robotic patients need that. They actually walk down to their own car. When I saw this patient, I realized that she's an excellent candidate for robotics. Her daughter is getting married. She's Hindu. And they have this certain thing about Hinduism whereby you shouldn't be bleeding when you go to the temple, just like in Islam. She's menopause. She's about 58 years old. She developed bleeding, what we call postmenopausal bleeding. And the gynecologist saw her, have already taken a biopsy and proved her to having pre-cancer. Not cancer yet, pre-cancer of the uterus. The problem with her is that why the doctor who looked after her don't want to operate on her, because she weighs 150 kilo, thereabout. And she's about 5 feet tall. Her BMI is about 55. She's super obese. All right? Now, if I were to do conventional surgery on her, I go to cut through layers and layers of tissue, and her recovery is going to be bad, going to be difficult, because she had to be fit and healthy in 3 weeks to attend a wedding in the temple. So she have a timeline. I need to be in the temple, my daughter we cannot cancel the wedding, it's all been planned, So she was referred to me specifically for robotic surgery, because they know by doing this keyhole robotic surgery, she's going to recover very quickly. The caveat is that, of course, there's no complication. So I assess her, I say, yes, you yourself is an ideal, not ideal, but robotic surgery is ideal for you. You're not an ideal patient because of your size, yeah? But robotic surgery is ideal for you. If you can do this well, we can make you better in 2 days. You can go home and attend the wedding, yeah? And because of her size, I got to pre-order certain long instrument because I need longer instrument than my conventional patient. We managed, so we did a lot of preparation. We prepared all that. And eventually we managed to get all the long instrument because we had to put a lot of stuff into her body through a long instrument because her fat was about one foot deep, yeah? So we managed to do the surgery. Went well, and she went home 2 days later. On the follow-up, about a week after surgery, she came back for, she became a transformed woman. She's smiling, she had her made up, she got lipstick on. She came and told me, "Doctor, I'm not smiled for the last 3 months, but I'm so well now, I'm so happy, I can attend this wedding." At the rate we are going now, with AI platform, in every aspect of our life now, I still think you can't be operated by a walking AI robot. The robot can make a diagnosis, but when you need surgery, you still need a human touch. The robot can help enhancing the skill of the surgeon. That I see is going to happen. The surgeon can even operate as long as his brain is working. Can you imagine that? If you have a skillful surgeon, but he become incapacitated by some kind of illness like his hand shaking, he can't operate anymore, right? But once your hand is in the robot, there's no more vibration, there's no more shaking. So some surgeons are so senior, they're so good, but because they have some illness, they cannot operate. The robotic platform may allow that.